healthcare. As you know, health is the largest chunk of the Ontario provincial budget. Yet, patients continue to endure very long wait times. There are calls for more doctors, for more nurses, for more hospitals. How will you meet these needs? And are you opposed to the expansion of for-profit private healthcare delivery? Again, you have 45 seconds, and Mr. Del Duca, will begin with you.
Well, I suspect, like most Ontarians, I was shocked back in February when Doug Ford's hand-picked health minister said that his government would actually relieve the surgical and diagnostic backlog, which is at an epic level right now, by inviting the private sector, private hospitals. Those were the words that she used to come in and help clear the surgical backlog. An Ontario Liberal government will focus on building up public health care. We'll clear the surgical and diagnostic backlog within 2 years by investing $1 billion in new money to make sure that our operating rooms are running 24/7 and on weekends and evenings, that MRIs and CT scans are also boosted. We're going to bring 100,000 new healthcare workers online within 6 years, and we're going to do it within the public system by scrapping Bill 124 and truly valuing our frontline healthcare workers.
Thank you very much. Ms. Horvath.
Thanks, Althea. You know, the backlogs and surgeries are really hurting people. I met a woman not too long ago who has a knee surgery. She has to have both her knees done, and she's on a long wait list. And she's at the point she can't even go up and down her stairs anymore. And now she's looking to see whether she can afford to buy a new home in this housing market. We do need to clear those surgical backlogs, but we know that our hospitals were on their knees prior to even Mr. Ford taking office. But then he started cutting in healthcare the minute he got elected, and then we had COVID. But privatization is not the answer. And New Democrats have always stood against privatization, notwithstanding that both Liberals and Conservatives brought privatization to home care and long-term care. We'll take it out.
Thank you very much. Mr. Schreiner.
The key to expanding healthcare capacity in this province and addressing the real wait times that people are experiencing is to invest in people. Nursing vacancies have doubled over the last 2 years. We're now short about 30,000 nurses. And when they're overworked, underpaid, and disrespected by their government through wage freezes, it's hard to recruit and retain nurses. So let's end the wage freezes that are wage cuts. Let's actually invest in ensuring that we have publicly funded, publicly delivered health care. Let's put people before profits when it comes to long-term care. And let's ensure that mental health is health by funding the mental health system we need through OHIP.
Thank you very much. Mr. Ford.
Well, when we came into office, our healthcare system was broken. You know, it was on the brink. It was already stretched to the max. And we inherited hallway healthcare, very, very clear, and everyone knows it. Our hospitals were crumbling for decades from a lack of investment. Even your Minister of Health said you starved the healthcare system. You stopped talking to the doctors. You know, we have a great relationship with the doctors and right across all healthcare workers, but we're investing back into healthcare with record numbers. We're investing over $40 billion in new hospitals, 50 projects right across every single region. We're hiring 8,000. We've already hired 8,600.
Mr. Ford, I'm sorry, I'm going to have to cut you off, but you can continue talking about your record in the face-to-face. First, though, we'll go to Ms. Horvath and Mr. Del Duca. Ms. Horvath, you can kick us off.
Thanks so much. There's no doubt that our healthcare system is in a shambles, but it is that way because of years of squeezing hospitals by the Liberal government, and people deserved better than that. The hospitals were on their knees when COVID hit. The Liberal government gave us hallway medicine, but of course, Doug Ford's cuts just hurt more. They make things worse and not better. That's why we need to invest in our hospitals. We need to scrap Bill 124, make sure that we're respecting those healthcare workers who we call heroes and then we treat like dirt, Mr. Ford. So we need to do that. We also need to get internationally accredited nurses and doctors on the front lines on our healthcare system. I met a doctor not too long ago. She lives in Buffalo. She lives in Fort Erie, and she's accredited from somewhere else, from another part of the world. And in Ontario, in Fort Erie, she cannot practice as a doctor every day. She crosses the border to Buffalo and works as a doctor. So we need to fix a broken system that's been broken for a very long time, get people return and recruit and retain healthcare workers, treat them with respect, get rid of Bill 124, scrap Doug Ford's low-wage policy, and really start providing the kind of services that people need. With more funding,
Horvath,
24/7, we can clear the
let's
backlog
bring in Mr.
of
Del Duca.
procedures.
So look, there's no doubt about the fact that there is a really, really brutal backlog that we have both in surgeries and diagnostics in this province right now. When I said in my opening remarks tonight, people are still struggling. That's why it's so important that there's a forward-looking and fully costed plan that will address those needs. This is not an abstract talking point for me. You know, a couple of years ago, respectfully, Ms. Horvath, a couple of years ago, my mom fell and broke her hip. And I have to tell you, though she got good care at the local hospital in York Region, it was so tough for our family and for her to navigate that system. It's only gotten worse over the past couple of years, talking about the surgical and diagnostic backlog. That's why the Ontario Liberal plan will invest $1 billion over 2 years so that we have MRIs and CT scans that are running full tilt, so that we have operating rooms that are operating on weekends, evenings, all the way through to clear that backlog. Because right now, if you need prostate surgery in this province, only 30% are able to get it on time. That's not good enough in a province like ours.
We have
to repeal Bill 124.
For all kinds of procedures.
Again, Ms. Horvath, respectfully, we're not here tonight to fight the 2018 election all over again.
There are new
challenges
you left
facing
a wreck
people.
behind you,
Listen,
and you have to step up and take some responsibility
there
for that, Mr. Del Duca.
There are new challenges
Where were
facing
you
the
when all
people.
these decisions were being made? Were you out
facing-
getting a coffee at the cabinet table?
Respectfully, there are new challenges facing Ontario because of how the Ford Conservatives walked away from their responsibility.
As did you.
I would rather that we would find a creative way to repeal Bill
Okay,
124 to make sure internationally educated nurses and doctors are brought online.
I'm sorry.
No
We're
problem.
going to give
Thank
Mr.
you.
Ford and Mr. Schreiner a chance to debate now. Mr. Ford, you may begin.
Well, as we're building the healthcare system and hiring thousands of doctors and nurses and PSWs, Mr. Del Duca, propped it up by the NDP and Ms. Horvath, you fired 1,600 nurses.
Why is
we're
it
hiring
private healthcare with
thousands.
you?
Mr. Del Duca.
Why is it private education and private healthcare with you all the
I
time?
know the truth really hurts,
Private,
but you fired
Mr. Del Duca.
you fired 1,600 nurses. Every region of this province, every region in this province is getting a new hospital. There's 50 new projects happening right across this province.
Yeah.
We're also paying for the nurses' tuition fees and for their books if they serve in underserved areas. We're taking care of them. We made sure the nurses got a $5,000 retention pay, which is on the average 7.6% increase. We've given the PSWs $3 permanent increase. And that far exceeds what your government did, Mr. Del Duca, propped up by the NDP.
You want
We're
private
building,
healthcare.
we are actually building the healthcare system that we need for the future and hiring more nurses. We have 720 doctors coming online. That takes care of 750,000 patients. We're building a med school out in Brampton. We haven't seen a med school in decades, but we're building a med school to make sure that we get more doctors into the hospitals.
Forgetting about the Northern Ontario
Mr. Del
School of
Duca, you
Medicine.
had your chance. Let's bring in Mr. Schreiner.
Mr. Ford, have you talked to a nurse lately? Have you talked to a nurse about how disrespected they feel, how overworked and underpaid and underappreciated they are, how insulted they feel being called heroes and then essentially having their wages cut by having them frozen? Mr. Ford, if you want to build capacity in our healthcare system, you have to make sure you invest in the people who deliver that care. And nurses are the backbone. They deserve to have Bill 124 gone. They deserve to have the opportunity to negotiate fair wages and fair benefits. You know, even their mental health care benefits were frozen because their entire benefit package was frozen. Have you looked somebody in the eye who lost a loved one in long-term care and explained to them that $171 million of money drained out of our long-term care system into the private pockets of shareholders at a time when people were scrambling for PPE, when seniors were trying to get access to vaccines, when PSWs were desperate to have a little bit of support to care for people and save their lives? We are better than this as a province. We can put people and care before profits. That's what it means to have a publicly funded, publicly delivered, public healthcare system. Care, people first.
Do you want to have 5 seconds
Oh, I
left to
have
respond?
5 seconds to respond. I don't know where you're getting your figures. We're building new hospitals. They want to work in a clean environment. There's hospitals that were 80 years old that were crumbling. They want to work in a clean environment, and we're building the hospitals
You
to
need
make
people
sure
to
they're
work in
taken
Thank
care
those
of.
you.
hospitals.
Thank you
Mr.
very
Ford.
much. Thanks
Nurses
to
take
all of you
representatives
that-
to work in the hospital.
Thank you.